So today we're going to put in a catheter. So you check the medical records and make sure, the patient actually needs a catheter, that there's an order for it, and to see what your patient limitations really are, whether or not they can help you at all. You're going to come in, you're going to identify the patient, name, date of birth, check their wristband. You may have to scan it, not sure. And then we're going to talk to them about the procedure. So I'm going to put a catheter in today. You're holding your urine. You seem to be unable to actually void your urine. So that is getting full. Your bladder's getting full. It's going to start to become painful soon. So we're going to go ahead and put the catheter in to release that pain. All right. So we're going to start by bringing the bed up to us. And we did gather our supplies here. We have an actual kit for this, which is actually very convenient. And then of course we have a bath basin for pericure. Alright. So we're going to go ahead and get the patient into position, which of course means making sure that you draw the curtains or whatever for privacy, because we are exposing the patient. We're going to make sure that their legs are in a frog-leg position and the spread so that we can get to the area that we need to. Okay, and we will perform some pericure, making sure that the patient is fairly clean. Okay. And then we will change gloves. We don't want to keep those gloves on. We'll go ahead and open our packaging. We have a garbage can at the ready for us with a biohazard bag in it. And now this packaging is sterile, so you have to keep your sterile field with it. Okay, so remember you have a 1-inch border as a standard. Alright, and then here we have our surgical gloves. I'm going to put them on the cuff side towards you. Okay, and make sure that they don't actually touch anything else, because these are in fact sterile. My dominant hand is my right hand, so I'm actually going to pick up the right glove first and slide my hand into this, if it'll go in, because these seem really small for mediums. Okay, and I'm struggling to do that because I decided to try and put 2 fingers in one finger hole. Okay, the other one we're just going to cut. Remembering not to use your thumb. Obviously, be careful about this. You want to maintain your sterile field. Okay. Now that my sterile gloves are on, this will go in the garbage. And we're going to open our first drape. At this point, you should have put a chuck underneath the patient. Sometimes they can lift their butt up for you. Sometimes they can't. You want the chuck there in case there's any release of fluid. You're going to fit in this. The bottom side is not sterile, but the top is. If your arms touch the patient's legs, that's okay. Not your hands, because you want to remain sterile. Okay, and with these, it's shiny side down. Alright, so you're creating this sterile environment so you can move things there and still use, because we're going to need a little bit of room to do this. This goes over your patient in the area. Once you touch the patient with your hand is no longer sterile. So do be careful of that. Alright. Our patient is allergic to iodine. Oh, you know what I forgot to do? Okay, I forgot to set up my bag for my garbage can, but I can't do that now or I will mess up my sterile gloves. So you can fold the bag up and use that as a garbage can. It's convenient. I do have a garbage can right here, so I will have to use that currently. Alcohol, hydrogen peroxide on your cotton swabs to clean. That would go in the garbage. Lube would get spread on this little tray, and that would go in the garbage. All right, we are going to pull out our piece, and it is a closed circuit. It is all-in-one, which is very convenient. Otherwise, we'd have to put all of that together. We're going to grab our syringe of water, take the top off, garbage, and then this is going to get put onto our tubing. This is for our balloon. Okay, then we're going to grab the catheter and pull it out. Be very careful about this because this catheter can go flying and you don't want it touching anything. Again, we're trying to be sterile. All right, garbage. And you're going to put the end of this in your lube. It'll kind of hold it in place as well. Okay, now you're ready to touch your patient. This is no longer going to be a sterile hand. You're going to spread the labia, and you're going to go down one side, and then down the other side, and down the center. Do not release your hand or you will recontaminate that field and you'll have to do it again. Okay, so now we're going to grab the catheter. It should have 1.5 inches to 2 inches of lube on it. And you're going to tell your patient to breathe deeply as you slide the catheter in very gently. If you come to a point where it doesn't want to go in anymore, just twist it a bit. Okay, once you see urine flowing back out of it, you're going to push it another 2 to 3 inches. Okay, pinch it with that hand that's you were holding the patient with, and then use your sterile hand again to fill the balloon with your water. Okay, once you fill the balloon, you're going to pull this back until you feel it kind of tight. You want that balloon to seal on the bladder. Okay, and that's installing a catheter. This is going to go on the side of the bed, not interfering with the side rails and not interfering with it going up and down. Basically, you want your patient comfortable. Of course, you would clean all of this up. This would just rip and it would all go into a giant pile and in the bag, biohazard bag, of course, because we are dealing with bodily fluids. Cover the patient up. You can perform pericare if you want to. Again, I probably would just because the area is generally usually a little bit dirty. I mean, you did it once, but you can do it again. It never hurts to do it again. And get the patient into a comfortable position without kinking the tubing. Be careful that your tubing is not kinked. You will end up securing this before, of course, putting the patient in a comfortable position, to the leg, because you don't want this getting tugged on. There are a couple ways to do it. Most people kind of like to do a little bit of this and that. You want to make sure that it's not really going to move a whole lot on your patient. Okay. To remove the catheter, again, you're going to check the patient's orders. You're going to make sure that the catheter is no longer needed, and then you're going to come in and talk to your patient. Identify the hand hygiene after the last one. Hand hygiene again now. Washing hands, we're dealing with bodily fluids. You're going to come in and tell your patient, name, date of birth, check their band, and let them know that, we're going to take your catheter out today. You no longer need it. You're clear to ambulate to and from the bathroom just fine on your own. So, we're going to get rid of that nuisance for you. All right, so you come in and don gloves. You're going to take off what it is that is securing your catheter to the patient's leg. You're going to get a 10 mil syringe. You're going to attach it. You're going to empty the bag. You don't want it spilling out. Alright, after you do all of that, you might want to change your gloves because you just emptied the bag. The syringe will have started to fill. It will fill automatically. Let it fill from gravity. Do not pull back on it. It will fill and the catheter will of course come out. You can perform pericare before this. You don't really have to. You definitely have to after, because oftentimes some urine will leak out. You should have a chuck under your patient in case the urine does leak out. Again, your patient might be able to help you with that in terms of lifting their butt, you know, especially if they're ambulatory. Alright, we should be about full. And we'll pop that off. And gently tell your patient to hold their breath and pull it on out. You're going to coil it up and put it in your biohazard bag to dispose of it. Alright. You're going to then perform pericare. You want to clean the area, make sure the patient is good and clean. Each wipe you're going to use a different side of the washcloth. And then you're going to cover your patient up, pull out all of this fun stuff, put it in the garbage. Relax your patient position-wise, make sure they're comfortable, make sure they don't need anything, make sure they have their call lights, and then you'll lower the bed back. In between removing the catheter and performing your pericare, you will want to change gloves and do hand hygiene. And again, you're always going to want to wash your hands because we are dealing with bodily fluids. Alright, thank you much.